What do the HIV rashes look like? Hello, it's Mark Medicals with the latest on HIV cure news, HIV treatment, HIV symptoms, and all about HIV tests. In today's video, you will also learn more about the following. 1. Where do HIV rashes appear? 2. How do I know if my rash is HIV or AIDS? 3. Is HIV rash the same as AIDS rashes? 4. How to treat an HIV/AIDS rash. As a bonus, I will also talk about HIV tests, so be sure to watch the whole of this video before asking your questions concerning HIV testing. Alright, here we go. 1. Where do HIV rashes appear? Guys, HIV rash is one of the early HIV symptoms that occur in the first 1 to 2 months after HIV exposure and infection. It appears alongside other early HIV symptoms like fever, flu, body weakness, night sweats, enlarged lymph nodes, and others. This HIV skin rash usually lasts for only 1 to 2 weeks and then disappears by itself. What I need to remind you is that not every skin rash is due to HIV. Also, everyone, HIV positive or negative, has a risk of suffering from body rashes. But according to various researches, people living with HIV have a more than 65% risk of suffering from HIV/AIDS skin rashes. It's an irritating rash with a flat, red patch covered in little red bumps that commonly occurs on the abdomen, face, arms, or legs. 3. How do I know if my rash is HIV or AIDS? There is absolutely no way you can tell if your HIV rash is due to early HIV unless you take an HIV test. If you recently had an HIV exposure and had a skin rash in the next 1 to 2 months, go for HIV testing as soon as possible. If you test negative, then your body rash is likely due to other diseases like a hypersensitivity reaction or certain allergies, syphilis, certain medications, and HIV phobia or anxiety. A skin rash after a couple of years of HIV-positive living is a sign of AIDS rash, which kicks in once your body's defense is weakened by HIV. If you are not on any HIV treatment or medications, your risk of getting HIV/AIDS related rashes is higher. So, guys, you can only know if you have HIV rash only if your HIV test is positive. 3. Is HIV rash the same as AIDS rashes? No, early HIV rash and AIDS rash are different and occur at different periods. HIV rash attacks you soon after infection and lasts for a few days to a few weeks. On the other hand, AIDS rash appears after 5 to 15 years and is common in people who are either not on any HIV medicines or whose body's immune system is still very weak. AIDS rash is very itchy and leaves black or red spots on your skin. You can identify AIDS rash more easily than it is for HIV rash. 4. How to treat an HIV/AIDS rash. You may not need any treatment for HIV rash because it lasts for a few days and disappears by itself. If the rash persists, it will be treated with over-the-counter antihistamines or steroids. On the other hand, AIDS rash needs aggressive treatment with the already mentioned medications. If you are not taking antiretroviral drugs, your body rash will disappear a few weeks after starting your ARVs. Also, you could start seeing skin rash days after starting antiretroviral drugs as a result of either improved body immunity or as a side effect of the medicines. As a bonus, here is what you need to know about HIV testing. Every type of HIV test kit has its own window period. HIV-RNA has a window period of 10 days to 33 days, the 4th generation window period is 14 days to 45 days, and up to 90 days for rapid-only antibody tests. 4th generation HIV and HIV-RNA will give you conclusive results after 45 days, while rapid antibody-only tests are conclusive after 90 days. HIV test results conclusive means the highest accuracy. Do not test again if you have a negative conclusive test, unless you had additional exposures. Having symptoms does not mean having HIV. If your test is negative at the conclusiveness period, then the cause is either HIV phobia and anxiety or other diseases. Early HIV symptoms do not last for many weeks, and as I have said many times, no symptom confirms an HIV infection. Many people living with HIV have no symptoms even after testing positive, but you guys keep mentioning symptoms yet you tested negative. In summary, HIV rash is an irritating rash with a flat, red patch covered in little red bumps that commonly occurs on the abdomen, face, arms, or legs. Hope the question, what do the HIV rashes look like, has now been answered.